Welcome to the recording of the webinar, Intro to Lifestyle as Medicine. The webinar is hosted by Dr. Lilach Malatskey. Presenters are Dr. Charlotte Salter, Dr. Tehila Mazal and Dr. Miriam Maisel, with welcome messages from Professor Dr. Shlomo Vinker and Dr. Fraser Quin. This webinar was recorded on the 24th of August 2023.
So we will start, and I hope more people will join, but we will start on time. So welcome to the webinar, Introduction to Lifestyle Medicine, a joint activity of the Lifestyle Medicine Wonka Europe Special Interest Group and the European Lifestyle Medicine Council. I'm so happy and excited to see so many people from all around the world, and it is really a wonderful evening ahead of us. I am Lilach Malatskey. I'm a family physician from Israel and the initiator and leader of the Wonka Lifestyle Medicine Special Interest Group. I would like to invite Professor Shlomo Vinker, Wonka Europe President, and Dr. Fraser Quin, Executive Director of the European Lifestyle Medicine Council, for introduction and greetings. Shlomo, please.
Good evening, everybody. Dear Wonka members, dear guests. It is my great pleasure and great honor to open this webinar about lifestyle medicine. It is a nice introduction to the field. We are used to prescribe medications, sometimes few medications, and many times too many. Dealing later with compliance, adherence, drug-drug interactions, drug-disease interactions, etc. But we have other tools in our toolbox, and this is using lifestyle medicine tools. We introduced the special interest group of lifestyle medicine in Wonka last year in our council in London. And slowly but steadily, activity is increasing. And it is relevant not only to our patients, but also to us, not as patients, but as healthcare providers. So I'm sure that after this webinar, we will be able to spread our spirit among all family doctors and other healthcare providers around Europe. Wish us all an inspiring evening. And thank you, Lilach, for the initiative.
Thank you, Shlomo. And Fraser, please.
Sorry. Welcome everyone on behalf of ELMC. My name is Fraser Quin. I'm the Executive Director for BSLM, ELMC, and the World Lifestyle Medicine Organization. I'm delighted that we're collaborating with Wonka and in particular the Lifestyle Medicine SIG, and thank you, Lilach, for organizing this evening's event. It's very inspiring. I'd like to introduce you to the European Lifestyle Medicine Council and WLMO very briefly this evening. So the European Lifestyle Medicine Council has been designed to support the development of lifestyle medicine associations throughout Europe. So this is not about individual membership. This is an organization that facilitates the growth of societies. So it is a membership of societies throughout Europe. We currently have 22 members, and it's great to see delegates on this evening from Poland, Lithuania, Turkey, Portugal, all of which are have member organizations in the European Lifestyle Medicine Council. The European Lifestyle Medicine Council was also a major driver, and I'd like to introduce you this evening to the World Lifestyle Medicine Organization. The World Lifestyle Medicine Organization is the only lifestyle medicine representative body globally. It was established and registered in Geneva on the 16th of February of this year by 20 members, and that has grown now to 37 members. So relationships with organizations such as Wonka are extremely important in the development of both ELMC and the World Lifestyle Medicine Organization moving forwards. These organizations are led by general practitioners, consultants, physiotherapists, many other allied health professionals, but all evidence-based lifestyle medicine organizations and all democratically elected. So once again, thanks for the opportunity for us to present tonight, and Charlotte Salter is representing the ELMC. We're delighted to collaborate with Wonka and hope to do so many more times in the future. Thanks very much, Lilach.
Thank you, Shlomo. Thank you, Fraser, for the introduction and for the encouraging words, and really happy to collaborate and hope for more to come. Just a small introduction about lifestyle medicine, because maybe some people who join us know a lot about this, but maybe some others are curious and want to know what is lifestyle medicine. So during the last decade, lifestyle medicine has evolved as a specialty alongside the dramatic rise in the prevalence of chronic diseases that can be avoided or better managed with the adoption of a healthy lifestyle. Lifestyle medicine is a medical specialty within the conventional Western medicine. This is important because many people think it's like some not an EBM medicine, and I'm sure Charlotte will discuss that further in her lecture. And we use therapeutic lifestyle intervention as a primary modality for prevention, treat, and even reverse chronic health conditions. So to develop lifestyle medicine within Wonka, Europe, we initiate this SIG last year, and it is our belief that physicians can and must know more and help their patients to improve health behavior and adopt healthy lifestyle. We invite each and every Wonka member who is interested or involved in lifestyle medicine to join us and become part of this very important movement. And for more information, I will put through our site. We have a site in the Wonka Europe, bigger site, a site of our special interest group. You can become a member and you can contact me for everything that you want to develop or do with this in this area. We have this evening wonderful lectures that I hope will give some ideas and some practical tips for you to apply it in the clinic. If you have any questions during the presentations, please write it in the chat. I see that you use it, and you're welcome to add questions. And after each presentation, the presenters will be able to answer some, hopefully, of the questions. So I would like to invite Dr. Charlotte Salter, a family medicine specialist currently working in Oslo, Norway. She specialized in the UK, starting her career as a general practitioner in the Royal Air Force, and then moved to Norway and completed the International Diploma of Lifestyle Medicine. Charlotte has co-founded the Norwegian Society of Lifestyle Medicine and is an associate member of the European Lifestyle Medicine Council, ELMC. Charlotte will describe in her lecture the 6 pillars of lifestyle medicine. Please.
Hi, my name is Dr. Charlotte Salter. I'm a GP in Oslo, and I'm also an associate member of the European Lifestyle Medicine Council, and I've also co-founded the Norwegian Association for Lifestyle Medicine. I'm going to hop right into talking about the 6 pillars of lifestyle medicine because it isn't very long to cover everything. And also just say we don't get much chance in this lecture to talk about why we need lifestyle medicine or an overview of the whole discipline, but hopefully whilst we dive into the 6 pillars, some of this will come out anyway. And these 6 pillars probably aren't anything new to you. There are areas of lifestyle that as doctors, we probably touch on quite a lot in our consultations or would like to. And they also come to mind when we read guidelines, because often it is the first step in many of the different guidelines. So, for example, here I've taken the hypertension guidelines from NICE, and right at the top, offer lifestyle advice and continue to offer it periodically. So there it is, right at the top. And if I could go to the next slide, yeah, so for diabetes, type 2 diabetes, at each point, reinforce about diet and lifestyle. I suppose my question for you guys is, do you feel equipped to talk about these areas in enough depth? Are you convinced that these lifestyle changes are actually enough that are going to help your patients? And do you have the same evidence at the tip of your tongue about exercise and nutrition, for example, as you do about a statin to reduce cholesterol? So why do these 6 pillars exist? So lifestyle medicine is an evidence-based discipline, and a common thread among the different national organisations is the knowledge and utilisation of these 6 pillars. The pillars represent the areas where we know from scientific research that we can modify patient behaviour, and that will have a positive effect on health. So I just also want to acknowledge that lifestyle medicine isn't just about the 6 pillars. We know that genes and epigenetics, social circumstances, medical care, environmental exposure, these all play a role, and it's a very complicated mess of factors that give us our health outcomes. But what we can see here from this graph is that 40% of what we are of our health outcome is from lifestyle. So this isn't to blame our patients. It's not to say you have made wrong choices in the past and therefore you're ill, but it's also just to acknowledge that they can make better choices. We all can, and we can do that. That will improve our behavior, and these small changes will lead to big things and hopefully health improvements. Okay. And I also feel very confident sitting here and talking to you about this because lifestyle advice is really low risk. It is the easiest thing that we can give to patients. It's free often, and you know, if we're looking here for other things that we tend to recommend to our patients of medications or surgery, this is really low risk. So next slide. Yes, take back lifestyle changes. As part of my day job, I was listening to some patient market research about treatment for being overweight. And the patients were asked about their experiences on trying to get help to lose weight from their GP. Now, the feedback did not paint the average Norwegian GP in a very good light. And I imagine there are many places across Europe where this is also the same. They said the GP did not have a time to address their overweight issue and would often mention lifestyle changes, but did not give any concrete examples. And the conclusion from the patients was that they did not believe that lifestyle changes work, and more or less the term was only worth an eye roll. This made me so sad, and I was like, no, we need to take this term back. Now we know our jobs are crazy busy and stressful and time pressured, but I think if we have enough time to explain how a statin works to reduce cholesterol and therefore reduce the risk of heart disease and stroke, we can probably prepare the similar kind of spiel to tell the patients about the effects of nutrition and exercise and how to direct them so they can read more in their own time. Now, this takes practice. And I know when I came out of medical school, I also wasn't equipped with the right information to be able to give my patients that succinctly. Okay, so therefore, the knowledge of the 6 pillars of lifestyle medicine is really, really vital, because you need to be able to pick the advice for each patient and be able to signpost to what is going to be useful for them. Is it a website? Is it a good old-fashioned leaflet? Is it an app? Is it a podcast that explains more? And unfortunately, there's not enough time to go through all this this evening, but I would really highly recommend either the BSLM core accreditation or the IBLM diploma, because this gives you the depth, but also the confidence to talk to your patients and about improving their future health outcomes. So I've tried to talk about a little bit in each of these areas. So we'll get going, but just to say, it's really actually hard to mention one pillar without mentioning another. These pillars are all interlinked. Okay, so the first pillar, talking about interlinked, mental well-being. Yeah, there are so many factors that contribute to good mental health, including what we eat, exercise, sleep, substance misuse, everything. It all plays a role. But what is really exciting is there is growing evidence that lifestyle medicine interventions can actually improve mental health. And 2 studies that spring to mind that are just there on the slide is the SMILES trial from 2017, showing that a Mediterranean-style diet can improve depressive symptoms. And also, I was really blown away by the amount of evidence in the systematic review that was published earlier this year in the BMJ, proving that physical activity can also manage depression. But I want to just take a moment to look at how physical health problems increase mental health problems, but also the other way around. And I grabbed this data from the King's Fund report in 2012. The King's Fund report estimated that 30% of people with long-term physical health conditions also have a mental health problem, most often depression or anxiety. And they also reported that mental health problems can seriously exacerbate physical illness, affecting the cost of their treatment. So they tried to put a price on it back in 2012, and they estimated that the effect of poor mental health on the physical illness that they already had costed the NHS £8 billion a year. I mean, that's just crazy. And I can't imagine that's actually decreased in the last 10 years. So what was their outcome? Their conclusion from that report was that to care for large numbers of people with long-term conditions, we could be improved by integrating mental health support with primary care and chronic disease management, and working closer with mental health specialists and other professionals, which I think include us as GPs. And I'm super excited to hear Dr. Miriam Maisel speak later on this evening exactly about this, some really concrete ways that we can help improve stress management. Okay, moving on to pillar number 2. So this is minimizing harmful substances. And I think it's really important as a lifestyle medicine organization and lifestyle medicine practitioners that we come to the patient in a non-judgmental way. We use a supportive approach based on replacing unhealthy habits with healthy ones. We have to listen to them, and without criticizing or blaming, we have to establish how they can move their own personal barriers that they've put up to change. And we know that when people misuse substances of any sort, it's normally because they want to feel better, they're struggling with anxiety or stress, but these harmful substances are often very ineffective ways to feel good, and we can help teach them about healthy alternatives. And these come back down to some of the 6 pillars, but sleeping well, talking to people, improve social connections, healthy eating, meditation. I mean, the list goes on. So one of the things that we need to be doing is getting them the support that they need. Okay, so pillar number 3, healthy relationships. So the CDC describes social connectedness as when you feel like you belong and you have the support and care you need, as well as the number, quality, and diversity of relationships you want. This is what is known as social connectedness. People with meaningful social connections have less stress, better sleep, better overall health, and they could lead a longer life with healthier habits and behaviors, and they have a better quality of life and sense of well-being. Well, that just all sounds great, doesn't it? So this is what we should be working towards. But we can also put it into a slightly less glib way of showing that actually people who have a good network around them, they have people they can trust and they can talk to and rely on, it actually increases their survival rates from serious illnesses. And we've all heard that smoking, that loneliness can be the same as smoking 15 cigarettes a day, or it's the same as drinking so much alcohol that it's like being an alcoholic. So I really feel that this is one of the pillars that can be difficult at first to discuss with our patients on a regular basis. But I think, how many times do we get to see our patients throughout their lives? We see them as a child, teenager, student, new employee to the workforce, new parent, tired parent, retirement. And each of these stages, it's really important for us to be asking, do you have support right now? Do you have a good connection with people? And if not, know in your local area, who can you refer them to? Because as we've seen here, that we really need to be talking about this. Moving on to healthy nutrition. So poor diet is a risk factor associated with many chronic health conditions. Globally, it's estimated that up to 11 million deaths a year may be associated with unhealthy eating habits. What we eat is really important and has the potential to make us sick, but also to make us better again. I'm a big fan of the phrase, food is medicine. Okay. But what clear information can we give to our patients so that we don't all end up with the guy at the end with that big body habitus? And I'm really excited to listen to Dr. Tehila Mazal, who's following the lecture with lots of tips on how we can guide our patients to eat healthier. So not to steal her thunder, I thought I would just hammer home about why we need to be giving this information. So this map is taken from 20, I've lost it now, 2012, is it? And really what it's trying to show is that there are large areas of Europe where we're eating far too much ultra-processed foods. And we know that a significant percent of our diet, that when a significant percent of our diet is made up of ultra-processed foods, that this leads to health problems such as diabetes, heart disease, obesity, and increased overall mortality. So actually, the good news is, since this graphic was released from 2018, some countries have actually managed to reduce their ultra-processed food intake. But looking at more recent studies from 2021, if you're looking at just children, they're actually still on average getting about 50% of their food is ultra-processed. And I think that as family physicians, we should really be, driving the message home that we all should be eating more whole foods that are minimally processed and avoiding ultra-processed foods, because this is only going to lead to a problem in the future. Sleep. So I think actually sleep sometimes was covered quite well at medical school, and we have quite a good understanding of how important it is and how it affects our physiology and REM sleep, etc., etc. And it's often a big part of what we do as a GP, especially when patients can't sleep, because they come in and tell us and want answers and help. And I'm sure we all have really good leaflet to hand them on sleep hygiene and websites to direct them to. But are we actively encouraging our patients to prioritize sleep enough to help improve their areas of health that I've written on this slide? And do you feel confident battling with Netflix or any other major streaming giants to convince your patients that they need to prioritize their sleep? Because sleep is not just there to make us feel good in the morning, but it's there to improve mood, mental health, decrease blood pressure, improve memory, stabilize weight. The list just keeps going on and on. So I definitely felt much happier talking about sleep in a really positive way of trying to encourage patients to really think about their sleep, even if they didn't feel like it was something they struggled with. When I found the websites and I found the podcasts that I could show to patients and say, here, listen to this. This is why you're really struggling. This may be one of the factors why you're really struggling with your mental health or your weight, for example. And I think what was kind of telling when I was reading up about this for the presentation is that actually, although maybe adults don't come and tell us about it much, but children, they're not sleeping so great either. And in March 2021, there was a study across 3 cities in Europe, and the majority of them did not sleep for long enough. And they also didn't consider their sleep of good enough quality. But I have very few children coming in to tell me about that. So I imagine that it's a massively underreported problem. There was also a similar study published in 2020 comparing adolescent sleep patterns in 24 European countries, and the average sleep length on a school night was not sufficient. So, we need to be talking about sleep, not just for those people who come in and tell us that they need some sleeping tablets, but also really driving home that sleep is a massive part of how we feel and our general health. So, last but not least, physical activity. So this graphic is rather scary, and it's there really to really drive home that physical inactivity is an independent risk factor. And quite recently, the WHO ranked it as the 4th leading factor for all-cause mortality. Sitting is the new smoking, I'm sure you've heard. But do you really feel confident in talking to your patients about exercise? Because it's sometimes difficult to know how much should they be doing and how much are they doing, and how do you quantify that, and how do you really encourage your patients to do any more? So here, how much do Europeans exercise? On average, we're not doing enough. And actually most countries across Europe have a similar guidance. It's based on the same evidence, saying that we should all be trying to achieve 150 minutes of moderate intensity exercise with the addition of 2 strength training sessions a week. And really for me, understanding how I could talk to patients about their exercise and try to gauge what they're actually doing was really important. And the word moderate intensity, I think, is really key here. So I often use the talk test when I'm talking to my patients. So, you know, when you're walking out in the mountains in Norway, can you sing a song? Or, okay, well, that's probably low intensity. Okay, but can you just about talk? Okay, well, you're probably hitting that moderate. And are you out of breath because you're going up some like really steep hill? Well, okay, maybe that you are reaching a high intensity for there. Okay. So I just wanted to look at this continuum, the illness-wellness continuum, because often we think about wellness as just the absence of illness. But actually, there are many degrees on both sides, as you can see. So from the red being really ill down to the blue being, you know, being really, really healthy and hopefully not getting sick. And the treatment paradigm explains how traditional medical treatments like drugs, surgery, psychotherapy, physiotherapy can get us to that neutral point in the middle. But if we don't talk about wellness and how to be well, then we're not going to tip over and start going up the scale. So at first, the wellness and treatment paradigms work together, but at some point, we have to start talking about, okay, are you actually looking after yourself? Are you going to keep yourself better so that they don't just tip back into the illness section again? And I think as family medicine doctors, we often get the privilege to meet our patients at various stages of their lives. And if we can try and impart some little bit of advice each time to help them continue on their wellness journey, then I'm sure we can make a really big difference. Okay. So last slide. This phrase has been really running around my head quite recently. Who is helping to teach patients how to stay well? And I think this kind of sums up the lecture here, because I believe that using lifestyle medicine, we can help teach our patients not only to avoid sickness, but also reverse and treat any illnesses they have. And I think that's what many of us wanted to do when we went into primary care. So hopefully you found this whistle-stop tour through the 6 pillars useful. I have got a list of my references here, but thank you ever so much.
Thank you, Charlotte, for this very important presentation. I think that by now everybody knows what are the 6 pillars of lifestyle medicine, and this is the first step to start using this medicine. But I'm sure that it's important to realize what we are doing through this this session. And we have one question by Ozdan that I think she's asking, what is the connection or the relations between climate change and heat change and all this to lifestyle medicine? So I don't know if you can answer that, but please try.
That's a bit of a challenge. You see, I read that the other way, as in like getting hot. So I was preparing a very different question in my head. I mean, a lot of the organizations in Europe that are lifestyle medicine organizations also have a focus on sustainability and climate change, and realizing that just by taking lots of medications and encouraging operations is often not cost effective and is hugely damaging to the environment. And we can improve our sustainability as doctors by employing more lifestyle medicine techniques, because hopefully, you know, going for a walk in nature is going to do them better than having a plastic pill pack that's been manufactured and shipped around the world. So I think there is a lot of connections between how we can together as a profession reduce climate change and work towards that. That's not one of the 6 pillars, unfortunately.
Great, thank you. There's another question from Jonathan. He asked, how do we measure the effectiveness of lifestyle medicine within the conventional medicine system when our patient contact is so limited? And I'm sure this is something that's bothering everybody when we present that new ideas.
Yeah, it is really difficult. And I think the key word is that we need a multidisciplinary approach. What we haven't discussed here, these are the 6 pillars, but what we haven't discussed is how do we implement it, and often we talk about motivational interviewing, but also group consultations and looking to everybody else in the wider family of clinicians, pharmacists and physiotherapists, nutritionists, etc. So we're all saying the same thing. But I think what's really important is that if we're not touching on something, on diet or exercise in our consultation, then who else is going to mention it, and they won't go and find out about it. So I think as GPs, we are such an amazing source of, and what's the word I'm looking for? We have such a great reputation. They believe what we say. So if we say, you can wait and see if you get better with lifestyle changes before you start your medicine, they're going to listen to that coming from us more than they're going to listen to it from a lifestyle influencer on Instagram, for example.
Yeah, great. Thank you. And one last question from Melika. What is the place of smoking cessation in 6 pillars in lifestyle management? Unfortunately, tobacco use is still high in Turkey. How is your approach to smoking addiction in lifestyle management? That's
a big one. I mean, it comes under minimizing harmful substances, and there's lots of different approaches for each of these pillars about how you're going to do it. These pillars are more like areas that we know are important and lead to better health outcomes rather than the exact way you do it. So if you're doing it through meditation, or you're doing it through group counseling, or using an app to help you track your habits, those are all very useful ways. But as we said at the beginning, it's not about not using medicine. So if they want to use a medicine to, like a tobacco patch, a nicotine patch even, to help them, that's not wrong. But the aim is that they're not going to smoke it at the end because we know that that's not helping.
Thank you, Charlotte. I'm sure there is much more and many questions that people can ask. And this is just an introduction session. And I hope we'll have more webinars going in depth in every of the pillars, and also tools for health behavior change and many more things that are in lifestyle medicine. It's an exciting area, and I hope you will feel as we do and join us in this in the future. So I want to present our next presenter, Dr. Tehila Mazal. She's a family medicine specialist, works in Israel. She holds a master's degree in public health and a bachelor degree in biology and psychology. Her research is focused on the Mediterranean diet and healthy cooking. She is a member of the Wonka Europe Lifestyle Medicine Special Interest Group. And Tehila, please, I'm sure we're going to enjoy your talk. You should unmute yourself and share your screen.
Thank you. I'm going to
working on that. Yeah. And please, questions through the chat or Q&A, and at the end we'll deal with.
Okay. And you will see my screen?
Yes.
So I'm going to start. Okay, good evening to everyone. I'm very excited and honored to be here in this webinar, in this important webinar, the first of many, hopefully. And I wanted to thank Professor Shlomo Vinker and Dr. Lilach Malatskey for organizing this, and of course our technical support, Barak. So I'm going to talk about the nutrition pillar. A healthy lifestyle and nutrition, healthy choices, preparations, and tips. Okay. So the doctor's role in diet counseling and the impact on patients' health. As I had such a good introduction before, thank you very much. So I'm going to talk about this. I have brought a few examples of researches and papers about these topics, and it's been proven that first, serve as a good example. Physicians' counseling is strongly related to one's own health practices. Physicians can positively influence patients' health habits, counseling them about prevention and health promotion behaviors. A lifestyle intervention can yield a better outcome than treatment with medications. For example, we have the diabetes prevention program research that showed that if there's a lifestyle intervention program, it reduced the incidence of diabetes by 58% versus giving metformin that reduced it by 31%, which is a big difference, all compared with placebo. So lifestyle intervention was significantly more effective than metformin, for example. This is just a few examples. One second, for some reason. Oh, okay. So behavioral counseling interventions in clinical settings are an important means of addressing preventive health-related behaviors such as poor diet. There is evidence that individual differences in personal health practices among physicians may have consequences for patients, which is pretty alarming because it means that the way we live and how healthy a lifestyle we conduct actually affects our patients in more ways than we could imagine. And it can have a very profound effect on how healthy our patients are. Take it in mind. There's a positive relation between physicians and patients' preventive health practices, and the chance that a person will lose weight is 3 times higher if the doctor talks to him about it. And rates of prevention counseling increase, and patients become more receptive to health promotion counseling from physicians who demonstrate healthy behaviors themselves. And another note I wanted to add here is that I'm sure you ask yourselves, well, why should we talk about nutrition if we have dietitians for that, right? So these are examples how important it is when a doctor talks to patients about this topic and knows about nutrition to give them the information. And sometimes you send patients to dietitians, you don't know if they'll go to them at the end. Sometimes they wait months for appointment, and sometimes they just won't go. So it's really important to seize the moment when they come to you and you can open the subject and talk to them about it and have the knowledge to share with them. So the majority of people, as I said, and this is another, cite their physicians as the primary source of information regarding health lifestyle decisions and are more likely to adopt a healthy behavior when the physicians recommend it. Okay. So I wanted to speak about the historical overview and current research, and we'll start about the historic overview about nutrition and how did we get to the Mediterranean diet or Mediterranean lifestyle. So this is the map of the world as you see, and you see the Mediterranean Sea and the different countries around it. And I'll just point out Spain, in Italy, in Greece, in Turkey, and Israel, and many other countries. So a bit of history. I like history. The ancient Greeks paid special attention to nutrition, believing that a correct diet was a preposition for the physical and mental health. It was thought that several diseases depended on incorrect diets. So different nutritional approaches were used to treat various disorders. Hippocrates, the father of Western medicine, in his work on diet, expanded his nutritional theory, emphasizing the importance of diet in the treatment of diseases. His famous aphorism, "Let food be thy medicine and medicine thy food," highlighted the importance he attached to food in maintaining good health. The Hippocratic diet was not a restrictive diet for therapeutic purposes, but rather a wise and balanced lifestyle that allowed maintaining a status of well-being. The concept of diet included, together with food and drinks, also physical exercise, just as contemplated by the current guidelines. The Greek food model, adopted by Rome and widespread throughout Europe with their achievements, remained the reference for medicine throughout the Middle Ages and Renaissance. Then, during the 1950s, Ansel Keys, with the 7-country study, showed, as we shall see, the existence of a clear relationship between Mediterranean diet and low mortality rates due to the coronary heart disease. Finally, in 1993, the Harvard School of Public Health presented the first Mediterranean diet pyramid, which we'll see soon in detail, produced by the Old Ways Preservation and Exchange Trust, indicating the recommendations for a healthy diet according to the rules of the Mediterranean diet. The pyramid has undergone several changes over the years, but the basic concept is substantially unchanged. Okay, so here you see Keys. In the 7 different countries, he included in his first groundbreaking research. Okay, so we have the USA, Finland, Yugoslavia, Japan, Greece, Italy, and the Netherlands. In Greece, he focused on Crete. The first research on dietary intake and food styles in the Mediterranean area dates back to the period after World War II. In 1948, the Greek government commissioned the Rockefeller Foundation to study the population of the island of Crete. Cretan Greeks, despite living in backward socioeconomic conditions then, had good health, minimal incidence of coronary heart disease, and exceptional longevity. From the questionnaires administered by the epidemiologist Leland Albo, it was emerged that the population practiced a poor diet based on cereals, legumes, vegetables, and fruit with limited consumptions of meat. These were meals very simple, prepared, and floated in olive oil. The important fact was not adequately evaluated, and only thanks to the results of the subsequent 7-country study, it was possible to demonstrate a scientific link between the abundant use of olive oil and the incidence of cardiovascular diseases. The Rockefeller Foundation study allowed to understand how food choices could affect people's health. Further support to the Mediterranean diet protection came precisely from studies on the ecological correlations between diet and coronary heart disease rates in different countries. The 7-country study was designed in the 1950s by Ansel Keys, as we said, mainly to verify a possible link between diet, lifestyle, and ischemic heart disease. Keys enrolled 16 population cohorts in 8 nations of 7 Mediterranean and non-Mediterranean countries for a total of 12,763 middle-aged men, obtaining follow-up data for over 50 years. The study demonstrated for the first time that the Mediterranean population, such as Greeks, especially the farmers of Crete, and southern Italians, showed low mortality rates from ischemic heart disease compared to the populations in Northern Europe and North America. The diet without caloric restriction, this is an important point, did not select specific foods, but was characterized by an abundant consumption of vegetables, a great use of olive oil, and extra virgin olive oil, I must emphasize, as a main source of fat, a daily intake of fresh fruit, a low intake of red meat, moderate consumption of wine, fish, and poultry. Limited dairy products and limited dairy products. The differences across countries in coronary artery disease rates were closely related to different intakes of saturated fats and average levels of serum cholesterol. The Mediterranean diet was associated with a lower incidence and mortality from coronary heart disease, with the lowest mortality rates and the highest survival rates. This pioneering large ecological investigation, despite its limitations, is still internationally recognized as the seminal study in this area. So here you see the all-cause mortality across the cohorts. When you see Greece is the lowest, and this is over 40 years. Okay. So the Mediterranean diet, while emphasizing this diet because there are many other diets, has been topped the scale as the best diet overall, #1 diet in the annual best diet ranking for the 6th consecutive year. This is, for example, from the US News and World Report. And the reasons are, it also ranked first in the categories of best diet for healthy eating, easiest diet to follow, best diet, plant-based diet, best diet for diabetes, and best heart healthy diet. The Mediterranean diet tied with the DASH diet. I'm sure you heard of the DASH diet and you want to know what the difference is. For the best diet for bone and joint health and heart healthy diet, for example, for high blood pressure. The DASH diet stands for dietary approaches to stop hypertension. It focuses on eating foods high in blood pressure, low in nutrients like potassium, calcium, magnesium, and fiber, and low sodium. But in general, it's very similar to the Mediterranean diet. Okay, so why the Mediterranean diet is #1? So numerous studies have found the Mediterranean diet can help weight loss and reduce the risk of high cholesterol, lowering the LDL and triglycerides and raising HDL, CVA and CVD, diabetes, and improves blood sugar control for those who already have diabetes, dementia and memory loss, depression, as we mentioned before, and has been linked to lowering the risk for breast, colon, and prostate cancer. And all of these have been proven also and shown in the PREDEEM study, which I want to talk a little bit about. It's a randomized clinical trial that went on for about 5 years. Authors followed 7,000 women and men, because as I said, there were only men in the previous study. This time it's women and men, and it's a randomized controlled trial in Spain who had type 2 diabetes or were at high risk for cardiovascular disease. It was the first randomized clinical trial, as I said, designed to evaluate the beneficial effects of Mediterranean diet on the primary prevention of cardiovascular diseases, performed in Spain from 2003 to 2011. They were randomly assigned to 3 diet groups. A group of Mediterranean diet supplemented with extra virgin olive oil, the Mediterranean supplemented with nuts, and a control diet that were advised to reduce fat. So it was a low-fat diet. The assignment to an unrestricted Mediterranean supplement with either extra virgin olive oil or nuts was associated with a low risk of major cardiovascular events over a period of 5 years, compared to assigned to a control low-fat diet, with a relative difference of 30% and an absolute difference of 1.7 to 2.1 percentage points. Subsequently, there were a series of sub-studies done on the PREDEEMed first study concerning other chronic conditions and were published afterwards. The incidence of the metabolic syndrome, diabetes, hypertension, breast cancer was significantly reduced in individuals randomized to the Mediterranean diet, while it did not result in lower heart failure incidence. The Mediterranean diet has also shown beneficial effects in the treatment of obesity and decreased inflammatory biomarkers related to atherosclerosis. Although the mechanism involved are not fully understood till today, the abundance of these dietary patterns in antioxidants, fruits, vegetables, and anti-inflammatory molecules is likely to be remarkable. The protection observed in the PREDEEM study is linked to improvement of various cardiovascular risk factors, as well as to a significant anti-inflammatory and immunomodulatory effect in the short and long term. Here you see, how they were randomized to 3 different groups. The ages of the men 55 to 80 years, women 60 to 80 years. They were with high risk without cardiovascular disease, but they had type 2 diabetes or 3 cardiovascular disease risk factors as follow. So it was smoking, hypertension, high LDL cholesterol or low HDL cholesterol, overweight or obese, and family history of early onset. So you see the Mediterranean diet with extra virgin olive oil and Mediterranean diet with nuts was a much lower incidence of cardiovascular event than the controlled diet. Okay.
Now we have like 5 minutes.
Oh, okay. I'm going to try and go.
I want to leave time for Q&A.
I'm almost finished. Sorry?
There are many Q&A, so we want to leave some time for them.
Okay. So one more research I'll go over briefly, and it's very important, is the umbrella review. So in order to summarize the evidence, because we started to accumulate more and more research about the Mediterranean diet in the last few years. So there was umbrella review done in 2018 in order to summarize evidence and evaluate the validity of the association between the adherence to the Mediterranean diet and multiple health outcomes. An umbrella review of the evidence across meta-analysis of observational studies and randomized clinical trials, RCTs, was performed. 13 meta-analyses of observational studies and 16 meta-analyses of RCTs investigating the association between the adherence to the Mediterranean diet and 37 different health outcomes for a total population of over 12 million subjects. They found that a greater adherence to the Mediterranean diet is associated with a reduction risk of overall mortality, cardiovascular diseases, coronary heart diseases, myocardial infarction, overall cancer incidence, neurodegenerative diseases, and diabetes. So I hope I've convinced you. And also the ADA guidelines from 2021 recommendations for medical nutrition therapy emphasizes the implementation of a Mediterranean-style eating pattern to improve both glucose and lipid metabolism, thus minimizing individual cardiovascular risk and all the other elements you see in front of you. Include improvement in oxidative stress, inflammation, thrombosis, insulin sensitivity, lipid profile, endothelial dysfunction, and gut microbiota. So the Mediterranean diet is not only a way to eat, it's a lifestyle. The Mediterranean lifestyle emphasizes lots of vegetables, fruits, nuts, legumes, seeds, and fish with liberal use of olive oil, a moderate amount of dairy food, and a low amount of red meat and sweets. A way of eating common in Mediterranean countries such as Spain, Italy, and Greece. Avoids processed foods that are high in sugar, refined carbohydrates, and unhealthy fats, and as saturated and trans fats. But they do drink a little red wine socially during meals. The Mediterranean pattern focuses on enjoying food and drink with loved ones, along with being physically active and always keeping moderation in mind. So you ask yourself, so what about counting calories? So in general, we don't count calories in Mediterranean diet. We know that calories depends on amount of calories a day on age, sex, weight, height, and amount of exercise. To simplify it, we know that these are the carbohydrates, fat, and protein portions we should be having plus minus a day. So the Mediterranean diet simplifies all of this, and it keeps these proportions actually, and we don't need to start counting calories all the time. So these are the pyramid. This is the pyramid of the Mediterranean diet. It focuses on quality rather than a single nutritional food group. As you see, the foods that we want to eat the most of are at the bottom, the wider area of the pyramid, and as you go up, the foods that you want to eat less of. And at the top are the sweets and the meat. So it also gives an idea, it hopes makes the diet more visible and easy to understand and remember. And it was first explained in 1993, I think, and introduced to the public in 95. And as we said, it's gone through adaptations. So you can look at this later and see the portions that you should have of every group of food. And at the bottom, as you see, that stresses the being active, social, eating with family, sit-down meals, and there's also drinking water and have a glass of wine now and again. Okay, so almost finished, Lilach. So this is going over again what it features, and I'll go over it actually in my recommendations later. I'll just read the third paragraph. Social interactions during meals and exercise are basic cornerstones of the Mediterranean style of eating. Lifestyle changes that are part of the diet include eating with friends and family, socializing over meals, mindfully eating favorite foods, as well as mindful movement and exercise. And it's not so much as what you eat, which is beneficial and anti-inflammatory, it's in how they eat it. Okay, so how to choose healthy ingredients and provide healthier cooking methods. So, read the ingredients on the product. It's very, very simple. People don't read what ingredients are on the product they're buying. Let's say you're going to choose a cereal. So you don't know which are more high in fat, which are more healthy for you, which have more preservatives, more refined fats, sugars, flavorings, colors, so food additives, so trans fats. So you should read what's written on the ingredients, and then you can choose wiser. And less, obviously, salt, less sugar. If you can't make sense of ingredients or make it at home, very simple, don't eat it. Eat whole grain bread and cereals instead of white or low fiber. Have vegetables and fruit in as many different colors and in every meal. Prefer oily fish over meat. Have fish 2-3 times a week, like salmon, sardines, mackerel. Make your own dressing and paste. For example, don't eat ketchup, bought ketchup. You can make your own ketchup with tomato paste and a little bit of salt or oregano, or a little bit of wine vinegar. You just mix it up and make your own tomato paste. And you don't need to buy ketchup, which is full and loaded in a lot of salt and sugar. For example, prepare the food yourself and use healthier food preparation methods. Fresh food, like you just cut up fresh food and have it a fresh salad, for example. Baking or cooking in oven or steaming. And actually steaming is number one. Steaming food is an indirect cooking method that uses hot steam generated from water to cook food. It helps food actually retain its nutrition more than other ways of preparation of food. It also keeps the flavor, the color, and the texture better than other ways. So I highly recommend steaming. All are healthier methods than frying, that's for sure. Don't fry food. Add salt and oil, preferably extra virgin olive oil, at the end of cooking, just before eating. They actually showed that if you add it at the end, you actually add less. While cooking, if you start with salt at the beginning of cooking, it actually somehow disintegrates and it's less salty. But if you add it at the end, it's saltier with a smaller amount of salt. And let everybody choose how much salt they want to put on the food, which is better. If you want something sweet, have a fruit, preferably with a nut, or the whole fruit, and not even if it's fresh squeezed juice, it's better to have the whole fruit, because then your sugar levels don't shoot up as high. Prepare the whole packet, like you buy a packet of whole grain, some kind of grain. Just prepare the whole packet, and then whatever you didn't eat in the same meal, just refrigerate or put in the freezer so you can use during the week. You don't have to prepare every time from scratch. Makes it so much easier. You can just take out cooked food from the freezer or legumes, for example, and you can add them to any dish you make. And tips to give your patients in the clinic at last. So this is just a picture, photo I took of what I have in my room, in my clinic. So it's something to talk about. Patients ask me about it, they look at it, and it's easier for me to explain when I have it up on the wall, and I have pamphlets to give out. So my tip is to prepare a page for your patient to take home. You can also hang it, as you see, or frame it. or hang it as a poster or on the wall in your clinic. Include the Mediterranean pyramid as you see here. It really helps people to understand it, and it's easier to use it. And these are few guidelines or tips that I recommend, I thought of, that you can choose from, which you connect to and you want to have on the page that you give your patients. And just a small tip, because as Charlotte, as we said before, I also didn't study nutrition in my medical studies. For 7 years, I think we had 1 hour about nutrition. I think it's so important to self-educate and to learn more about it. And you can use the SMART model if you want to help patients start sticking to the Mediterranean diet. The same as you use for goals for losing weight, for example. And you can even just think of saying like the goal would be to replace soda with water every day for the next month, rather than a goal to give up all sugar. For example, we know that small steps help than one big, large decision, which can frighten or dismotivate. And these are my tips.
Tehila, we need to end 5 minutes ago.
Yeah, I said it might take a bit longer, I'm sorry. But little steps, like I said, make one little change to your diet every week. Drink water abundantly instead of soda and soft drinks, and move as much as possible. And here you can also give a few recommendations about exercise. Availability, have vegetables, legumes, fruit, nuts, seeds, all available, all in reaching sight in the refrigerator or in front of your eyes that you can just add, and don't forget to add to any dish. Have more than 5 portions of vegetables or fruit a day in different colors. Have a sit-down meal at least 2-3 times a week. Prepare at home made meals more than buying ready prepared meals. So try to have as much as homemade meals a week. Use different herbs and seasoning instead of salt, and use extra virgin olive oil instead of other oils or fats. And add legumes to your meals, to your salad, to your side dish, soup, or paste. And if you have only 30 seconds with your patient, because we know we don't have a lot of time, so I recommend or to make another appointment just especially to talk about this, or if you have 30 seconds, we all have, to say to what you say to your patient, so you can increase in vegetables and fruit intake and reverse the rising trend of diet-related diseases. Eating shared family meals prepared at home lead to a better choices and lower calories, and promote Mediterranean diet. And that's it. Thank you very much.
Thank you very much. It was very, very comprehensive and interesting. And in the last few slides, I hope you took them, you photo them, because it was very good tips, and that you can use either for yourself and for your patients. But just to know that this everything is recorded, so you will be able to go again through. Unfortunately, we won't have time for the questions, but I think through the questions, and some people answered the others, and also through your lecture, you answered some of the questions. So
I didn't see them.
Yeah, you didn't see them, but you answered them. It was in your lecture.
Great.
So we will continue straight to our last presentation. And I would like to invite Dr. Miriam Maisel. She's recently retired from the general practice work in the UK. In addition to the family practice, she has trained in lifestyle medicine and certified as lifestyle medicine specialist in 2018. She is one of a small number of non-US physicians to be qualified to teach the Harvard-based stress management and resilience training, and we are lucky to have her to introduce us with Dr. Herbert Benson's work and practice, hopefully a short experiential exercise towards the end of our meeting. And I would like to give the stage to you, Miriam. Enjoy, everybody. It's interesting very much.
Thank you very much, Lilach. Okay, can you see my screen?
Yes.
Okay, good. Just 1 second. I just want to see how I move from slide to slide in this view. Wait a second, 1 second. Okay. Yes. Okay. So thank you for that introduction, Lilach, and really thank you to everyone who's made this event possible. I don't need to introduce myself because Lilach has already done it. And I don't need to talk about what is lifestyle medicine because that's already been done. What I did want to mention is that as Dr. Salter mentioned, and also Dr. Malatskey, that lifestyle medicine is an evidence-based discipline, and the competencies for prescribing lifestyle medicine were set up by a panel of experts using very firm evidence base in 2010. So this is a very interesting position paper for anyone who wants to look into it further. Wait 1 second. So one of the principles of lifestyle medicine, as Dr. Mazal just mentioned, is physician leadership, and that in principle, a doctor who's practicing lifestyle medicine should also be taking care of themselves and taking care of their own lifestyle factors such as healthy eating habits, sufficient physical activity, avoiding harmful substances, and so on. However, even if we aren't taking care of ourselves, we could still, in most of the lifestyle medicine areas, give effective advice. And for example, I have never smoked, but I would still be competent to advise patients about stopping smoking, even though I have never had to stop smoking. However, in the case of stress management, it is different. And I am very, very convinced that in this area, we can really only help patients effectively if we have learned some stress management skills ourselves. And when I thought about this, I wondered, why would this be the case? And my conclusion is that while the other 5 areas of lifestyle medicine deal mainly with behaviors, stress management also deals with our mind, with acquiring a set of internal skills, which one could call perhaps psychophysiological skills, involving attention, cognition, mindsets, and so on. And unless we understand what it means to train our own mind in these areas, we will not really have the ability to help our patients develop these skills, which would be needed to reduce harmful stress. First of all, let's just take a minute to think for ourselves and about these 2 questions. What is stress, and when is stress a problem? And perhaps jot down an answer for yourself, or if you would put a word or 2 in the chat, we can have a look at that. Okay, I'm not seeing any responses in the chat, so I'm going to move on. Second. Oh. So stress can be defined as the body's response to a demand. These are deliberately simplistic definitions. This demand may be a major life event. We could have a small daily demand, but stress becomes harmful when the demands outweigh our ability to cope. It leads to wear and tear on the body, and it can lead to illness as well. Another definition is that stress can be defined as our response to a threat. And I would even say our preparation to respond to a threat, because a threat can be an obvious external thing, simplistically put, the hungry tiger. But not so obviously, stress can also result from internal threats, and particularly our own thoughts and attitudes, and especially for those of us who may be very conscientious or high performers, which is fairly characteristic of the physician population. And just think, when we say to ourselves, what if I can't make this deadline? What if I'm late for my job interview? What if I just made a mistake on a prescription? Please take a second just now to notice how you feel when you just hear these words, even though right now nothing has happened. So this is a kind of, can be an experiential demonstration of how our thoughts influence our state of being stressed or not. Some examples of how stress affects the body and brain. We know, because in the study of medicine, we learn all about the sympathetic nervous system. We know the heart rate goes up, blood pressure, oxygen consumption. We may sweat, blood sugar can go up, the digestive system shuts down, and so on. We have muscle tension, we're ready for action. And then there are also cognitive and perceptual changes that we may not think so much about, but when we're in a stress response, we're not really able to learn. We're defensive, we have a narrowed perception, and we have negative expectations. However, stress is not just a negative thing. We need stress. It's part of, we need a stress response. It's how we can protect ourselves and also how we can achieve. And of course, you know, we know that when there's a deficiency of the stress hormone cortisol in Addison's disease, this is extremely dangerous. So how do we differentiate between harmful stress and stress that may even be helpful? And it seems that there is a curve where at a certain point, as stress increases and arousal increases, performance also increases. But this doesn't go on indefinitely. And if we continue to load the system, we will have diminishing performance and even collapse and breakdown. And so this, we also know this from other areas of life. And, you know, if I could easily lift 10 or 20 kilos, I would struggle to lift 30. And if I tried to lift 50 kilograms, I wouldn't be able to do it at all. So there's an analogy there with stress. Where's my arrow? And this is a diagram that comes from the realm of education, where there's a similar idea that we may be in the comfort zone, we're not endangered, we're not challenged, we're also not achieving anything. If we stretch ourselves a bit, we can be in the learning zone. There's some stress, there's some arousal. But if we overdo it and we get into the panic zone where we're overwhelmed, learning and performance suffer. So I'd like to now just have a little look at patterns of stress over time. And there are four main patterns here. The first pattern is when we're subjected to a stress, we respond, and then we gradually drift back to baseline. The second pattern shows multiple small stresses But in between the stresses, we come back to our natural baseline. The third pattern is where things start to be problematic, where we have sustained and unrelieved stress and we don't come back to baseline. And this means we have high levels of cortisol and other stress hormones all the time. These impact on metabolism and can lead to physical problems, among other problems. And the last one is basically showing burnout when we no longer even have the ability to respond to stress. But I'd like to focus on the first and second as the reasonably healthy stress patterns, and the third one as something that we should be thinking of doing something about. How do we relieve that sustained stress and have an opportunity to come back to baseline? This is Dr. Herbert Benson, and he is one of the real pioneers of the mind-body movement. He was a cardiologist at Harvard and continued working right up until his death, researching, publishing, and so on. And he was working in the 1970s researching hypertension. He was using monkeys, and he was approached by a group of people doing transcendental meditation in Boston, who said to him, well, you know, why should you use monkeys? You can use us because we can control our blood pressure with meditation. So he was initially hesitant about working with them because it was the 1970s. This was considered, meditation was considered a very fringe kind of thing. He was at Harvard, but eventually he did work with them, and there were findings showing that through their mental technique, they could indeed exert some control over their blood pressure. So the meditators thought that the reason that their technique was effective was because of a specific mantra that they were using. And Dr. Benson became very curious and started to look for more universal physiological principles. And he looked at meditation techniques in many traditions, and then formulated a very simplified, very secularized method or set of methods based on his reading research. And what he said was happening when blood pressure could be lowered, he called this part of what he called the relaxation response, as opposed to the stress response. And like Ansel Keys, who was a great pioneer in the nutrition field, Dr. Benson was a great pioneer in the mind-body field. This is an old book. It's his first book. It's still in print and very useful reading for health professionals as well as lay people. So before we go into the science around the relaxation response, I would like to offer you a very short experiential exercise in order to get a taste. So if you can sit comfortably, please, if you want to try this. You can sit comfortably. If you're on a chair, it's good if your feet are on the floor, legs not crossed. A back ideally would be straight, comfortably straight, not stiff. And the hands can be in the lap or they can be palm down on the thighs. And eyes can be closed. But the eyes also can remain open, but not focused on anything in particular. So just taking a moment to establish this posture. And before we start, I'd like you just to notice how you are, how you're feeling. And so now we can begin this little practice by just becoming aware of the sounds that we're hearing right now. Our ears, our auditory system is working all the time. Sounds are coming in all the time. And for this exercise, I would just ask you to bring your attention to that. This does not require an intense focusing. Just connecting with what's happening. And there's also no need to block any other experiences. All our other sensations can be there. Thoughts can be there drifting in and out. You just leave those things alone. Just connecting with sound, the experience of hearing. And it's inevitable that we will get distracted. We get carried away by some thoughts. So when we notice that has happened, that's the opportunity to just come back and connect again with the experience of hearing. And now, before we conclude this very short experience, try once again to notice how you are. How do you feel? And so now we can finish. Move our body a little bit, maybe stretch. If our eyes were closed, we can now open them and be back to our usual selves. So, how was it? And if people wish to put a word or two into the chat of your impressions, it would be great to be able to see that. So I see people are saying it was relaxing, appeasing, good things, useful. Okay, yeah. So I think then, some of you, happy, relaxing, difficult to focus at times, calming, again and again. So this is a very, very short experience, but I think, some of you, hopefully all of you, have had a little taste of what's called the relaxation response. And this term that Dr. Benson created really is just the opposite of the stress response. And the physiology of it is also the opposite of the stress response. So when we're in a stress response, when we've got cortisol and adrenaline flowing in our blood, then we have, as we said before, increased blood pressure, heart rate, oxygen consumption, and so on. And in the relaxation response, what happens is exactly the opposite of that. So this is recovery. This is kind of a physiology of recovery. And we don't want to be in the relaxation response all of the time, but probably more of the time than what we are in our sort of crazy modern lives. And this, again, very, very simple, really the same thing. But I'm presenting these simplified diagrams because, although there is very complicated science that supports there are EEGs, there are fMRI studies that support what's happening. We have learned that, even the mitochondria take a break. For us as, first of all, as individuals who might be practicing this, or if we're bringing it into our clinics, we don't need to talk to our patients about fMRIs and mitochondria and all these things. And the traditions that this kind of technique were derived from, also, they were really pre-technological traditions. And there are many techniques which have been handed down over hundreds and thousands of years without a lot of technical knowledge. But I did want to share one diagram, which I think, if you remember one diagram from this talk, this would be a really nice one to remember. So when we're in the stress response, we are more driven by the amygdala. In the bottom diagram, we're more driven by basically fear and emotional reflexes, or maybe not reflexes, but strong habits. When we're in the relaxation response, the prefrontal cortex is more dominant. That's where there's reality testing, inhibiting inappropriate actions, regulating emotion. So I tend to call this bottom diagram the stress condition. It's control from the bottom up. And in the more relaxed and alert condition, it's control from the top down. I sometimes nickname that this is the responsible grown-up, responsible adults, rather than acting from our reptilian brain. So here's a research which, wait a minute. Yes, here's a research which was very interesting to me. This shows that people who practiced, but they were described as long-term practitioners of meditative techniques, such as the one we just did. In this study, long-term practitioners were people who practiced for 15 or 20 minutes a few times a week for maybe a couple of years. And when this group was compared to a group of people who were just starting to learn, it was found that the long-term practitioners, their baseline cortisol was lower than the new practitioners. Not only that, their baseline cortisol was lower than what the new practitioners were able to get to even after a session of meditation. So it means that the whole system can get reset, and this can have a lot of benefit when you think of the disadvantages of chronic stress. And so I'm going to just speak a little bit about the program that Dr. Benson created, because learning how to elicit the relaxation response is only a part of learning this stress management. Being able to elicit the relaxation response means that we can create a little bit more space for ourselves, mentally, emotionally. But the second part is learning how to recognize our own stress warning signs. You know, we're sitting in traffic and someone cuts us off and we feel something, but maybe, you know, before we jump out of the car and yell at them, we can recognize, oh, I'm stressed. So this is very important. And then the third part of this training involves, of course, what I call the container, other healthy lifestyle behaviors such as social connectedness, good nutrition, physical activity, good sleep, and so on. And adaptive strategies to really, when we have the space, when we can recognize our own stress, we also have a choice as to whether we want to let that stress escalate or whether we can choose another path. And so in the course that he designed, one looks at these stress warning signals, which are in different realms of ourselves, physical, cognitive, emotional, and so on. We look together in a group at different stressful events and how we experience them. And then we look at how we could perhaps have a more adaptive response to a given stressful event. And the training is also accompanied by daily at-home practice by the practitioners, by the participants of 20 minutes per day of relaxation response on the cushion.
Yeah, my dear, we need to finish because
yes,
10 minutes past our time, so I'm sorry.
Okay.
So interesting. I'm sorry.
Yeah, so I am finished except for one point that I want to make, which is that these meditation traditions are borrowed from these the great traditions, yoga, Buddhism traditions that mostly come from India and China. And we are really applying these traditions to, if you know Maslow's hierarchy of needs, we're applying them to kind of wellness needs, safety, security, well-being. The traditions in themselves have a lot more to them. They have a context of morality, ethics, altruistic values, transcendence, and so on. So although we are borrowing these techniques, they're effective for wellness, but I think we just need to retain a respect that we don't understand the whole thing just by doing, you know, relaxation exercises that are taken out of context. And I hope I have convinced you that the stress management pillar of the lifestyle medicine, it really is essential for us to experience and train in it ourselves in order to be able to use it to help patients. That I'm saying thank you. And that's how to find me if you wish to do so. And if we have time for questions, I'm happy to answer whatever you say, Lilach.
Yeah. Well, I can see that most of the remarks of the audience are that it was very relaxing, lovely, interesting, and not so many questions, but I think it's just a taste, and thank you, Miriam, for that. And maybe later on we can offer the full course for people who are interested to be more into it, because just 5 minutes of this relaxation that you've done is really something, and a lot of people enjoyed it, as we can see from the remarks. So thank you, everyone, for joining and being part of this activity, of this webinar. Thanks for all the great presenters. It was really very, very interesting, and I'm sure you gave a lot of things for people to think about and to dive into. And thanks for Burak for organizing all this, and for Wonka, Shlomo, and Fraser to give us the opportunity to be with you this evening. So you're all invited to join our growing Lifestyle SIG special interest group, and I've put through the link to our website and also to my personal email. So please feel free to contact me if you're interested to be part of this movement. And I hope to see you all in our next activities soon. So good night, and thank you very much, everybody. Thank you.